Heart attack. Immediate action required. Phone 999 immediately if you or someone else has symptoms like central chest pain or discomfort in the chest that doesn't go away. It may feel like pressure, tightness, or squeezing. Pain that radiates down the left arm or both arms, or to the neck, jaw, back, or stomach. Unconsciousness, seizures or fitting. Difficulty breathing, snoring or rasping. Rapid heartbeat. Low or undetectable heartbeat. Blue or pale tingling of knees, hands and lips. Chest pain and breathlessness, nausea, sweating or coughing up blood. What is a heart attack? A heart attack happens when there's a reduction in blood supply to part of the heart muscle. This lack of blood flow can cause damage to the heart. Sometimes, when chest pain occurs suddenly, it's unclear if it's due to unstable angina or a heart attack. Until tests confirm the diagnosis, doctors sometimes call this acute coronary syndrome, ACS. Diagnosing a heart attack. In order to find out if you're having a heart attack, you'll need to have some tests. These tests can include an electrocardiogram, ECG, to check your heart's rhythm and electrical activity. Blood tests to check the troponin levels. A protein that's released into the bloodstream when the heart muscle is damaged. An assessment of blood pressure. An assessment of blood oxygen levels. A chest X-ray. An echocardiogram to assess the structure and function of your heart. A coronary angiogram to identify any blood vessels that are narrowed or blocked. Based on your test results, your clinical team will decide your treatment plan. Treating a heart attack. When someone has a heart attack, it's important to restore blood flow quickly. This will minimise damage to the heart muscle and start to alleviate symptoms. Your treatment plan will depend on the type of heart attack you've had, your individual situation. Types of treatment. Treatment for a heart attack may consist of antiemetics to stop sickness and nausea, antiplatelet therapy, medication that thins the blood and gets rid of blood clots, coronary angioplasty, a procedure to widen coronary arteries that are blocked or narrow. Oxygen therapy, to help with your breathing and oxygen levels. Pain-relieving drugs, like morphine. Reperfusion treatment, to help restore blood flow and maintain the heart's pumping action. Thrombolysis, a clot-busting drug to help restore blood flow to your heart. People who have had a heart attack will need to take several different types of medication. Your doctor will try to find the best drugs for you with the fewest side effects. Complications of a heart attack. Sometimes there are complications following a heart attack. The most common complications after a heart attack are arrhythmias, problems with your heart's natural electrical rhythm. Heart failure, when the heart isn't pumping blood around the body as well as it should. Many problems resolve themselves quite quickly. However, sometimes problems linger and can often be helped by medication. Recovering from a heart attack. How long you stay in hospital will depend upon your circumstances and treatment. Don't be afraid to ask your medical team about what's happening. On discharge, you should be referred onto a cardiac rehabilitation program. Cardiac rehabilitation. You should receive an assessment to determine your individual goals and needs after a heart attack. Rehabilitation is usually a mix of exercise and education sessions. This helps to provide you with the information, advice, and support to understand your condition and medication, recover from your heart attack, procedure, or surgery, make lifestyle changes to improve your heart health. Your cardiac rehabilitation team can also give you advice on practical issues after a heart attack, including driving, mental well-being, relationships, sexual relationships, returning to work, long-term recovery. The British Heart Foundation has further information on cardiac rehabilitation.